Updated at 5:40 p.m. 2 Oregon children have died from the flu, which is raging across the state. One child died earlier this month and was younger than 5, state health officials said. The other died in December and was younger than 10. No more information was available. Oregon usually has 1 or no pediatric flu deaths a season, said Dr. Ann Thomas, a state public health physician. Last season there were none. But in 2009, a pandemic year, 5 children died in Oregon from the flu. It's something that we never want to see, said Dr. Richard Lehman, an Oregon public health physician. The deaths come amid a severe flu season nationwide, with 14 pediatric deaths as of the last week of December, according to the Centers for Disease Control and Prevention. In Oregon, labs have confirmed nearly 6,000 cases this season, which runs from October to April. The latest state report shows a sharply rising spike in emergency department visits for flu-like symptoms since the beginning of December, and it's yet to level off. During the last week of December, the latest statistics available, 5% of ER visits in Oregon were for the flu. That marks a new high in the past 5 years, Thomas said, surpassing 4% last year. It's taken off since Thanksgiving, Thomas said. ER departments in the Portland area have seen a surge of cases. But officials at Oregon Health, Clark County health officials released a statement warning of overcrowding in emergency departments. It advised residents to stay home unless they're experiencing severe symptoms such as difficulty breathing, confusion, pain in the chest or abdomen, blue lips or a skin rash, and in children younger than 3 months a fever or excessive irritability. Influenza is a nasty illness, Lehman said. If people get complications and those are not recognized and people don't get appropriate care, there can be a risk. Children with a fever and cough or sore throat who have trouble breathing should see a provider, Lehman said. In the Tri-County Portland area, nearly 200 people were hospitalized with flu-like symptoms the last week of December. That compares with nearly 140 the week before. There's no telling when the infections will level off, Thomas said. It could have happened around New Year's, but state officials won't know until the latest data come in. So far this season, nearly 550 people have been hospitalized with flu-like symptoms in Multnomah, Clackamas and Washington counties. That compares with nearly 1,600 last season. Seniors, as usual, have been hard hit. Oregon does not track adult flu deaths, but those with weakened immune systems, including people 65 and over, cancer patients and those with HIV, tend to be affected the most. Among nearly 40 flu outbreaks in the state this year, more than 70% have been in long-term care facilities. Another 15% have been in schools. Nationwide, the H3N2 strain has caused the most illnesses. Not so in Oregon. We're seeing more H1N1 than H3N2, Thomas said. That's different than the rest of the country. The H3N2 strain tends to be associated with severe seasons. The strain, which first started circulating 30 or 40 years ago, tends to affect seniors the most, though reasons for that are unclear. One theory is that the strain wasn't around when older people were growing up, so their immune systems were not exposed to it. But Thomas said the virus mutates so much that the current strain is probably nothing like what was infecting people 3 to 4 decades ago. The CDC does not yet have data on the effectiveness of this season's flu vaccine. That won't be available until February or March, Thomas said. Officials look to Australia, which goes through the season before North America, as a guide. There, the vaccine was pretty effective against H1N1, Thomas said. It didn't work as well against H3N2. With several months to go before the season ends, health officials say it's still not too late to get a shot. The sooner the better, because it takes 2 weeks to kick in. There are still a lot more people who will get sick this winter, said Dr. Jennifer Vines, Multnomah County Deputy Health Officer. The flu vaccine is not perfect, but it's the best tool we have. Children can get a shot at 6 months, and seniors are advised to get a high-dose vaccine. Even if it doesn't prevent the flu, a shot could stem the severity of symptoms and prevent deaths, health officials say. Lynn Terry, Altaria at Oregonian.com, LynnPDX.